this scheme. I request our revered principal to welcome the participants and the NSS program officers. Sir, please, sir.
Yes, sir. So, most respected resource person of this international webinar, Professor Dr. V. Kabilan, Professor from Rutgers School of Dental Medicine, Department of Oral Biology and Infection Disease from New Jersey, USA, respected Dean Extension, Dr. Palanisamy, respected program officers, Dr. Ilangovan, Dr. Suresh Kumar, and Dr. Shyamala Vasanti, and my dear participants all over the nation, both the students as well as the public. I welcome all of you on behalf of Dr. SNS Rajalakshmi College of Arts and Science, Coimbatore, Tamil Nadu. So it is indeed it's a great pleasure for me to welcome our chief guest from New Jersey, Professor Kabilan. Good morning, you sir. I don't know your time. Probably it may be good evening for you. Yeah, it is good morning, you sir, as far as Indian time is concerned. So the title the extension department has chosen is very wonderful. Exploring alternative medicine for the prevention or treatment of COVID-19. Today everyone in the world, from every nook and corner, all are waiting for a medicine or some other alternative medicine should come and save them. Every day the people, when they come out step down from their house, they have a fear that they may be infected with COVID-19. So it is a kind of fear everyone, including myself. Whenever I step into my own car, getting out of my own car, it is happening. So it is really a very pathetic situation for the entire mankind. So it is the right time to discuss on some alternative medicine, at least to prevent or to treat this infectious COVID-19, which may give some kind of moral support to the people of the whole world. So I request Professor Dr. V. Kabilan to share his views on the alternative medicine for prevention and treatment of COVID-19. Sir, thank you so much, sir, for spending your time over with us, and you are going to give some kind of motivation, and which may boost our morale in another few months. By that time, we may get rid of the COVID-19. I hope so. Thank you, Anandal, sir.
Okay. Thank you, sir.
Thank you, sir, for motivating speech, always inspiring us. Thank you, sir.
Thank you, sir. Thank you.
Sir, so I request the chief guest, Dr. Kabilan.
Yes, sir. Can I start?
Sir, please you start, sir.
Yeah, okay. Thank you, Dr. Prem Nazir, Principal. It's a great, nice introduction. For me, it's a night 1 o'clock.
Yeah.
Midnight.
Extremely sorry, sir. We are disturbing you in the midnight.
Privilege to, to share my, experience as well as, share the COVID-19 pandemic, era. So it's happy to be part of this, international webinar. First of all, I would like to apologize. Last time I could not able to make it, the seminar because it's never happened for last 25 years. It's the third time power cut for us due to this hurricane season. So unfortunately, I could not able to make it. I am apologies for that. Before I start my talk, I would like to take an opportunity to thank Dr. Palanisamy, Dean for Extension. He's my mentor and he's guiding me a lot through my life. Still, I remember my first day at undergraduate PhD as well as masters in Kungunad Arts and Science. So he's my well-wisher and everything. Thank you, sir, giving me an opportunity again. And also I see you at this time after 25 years. It's a great opportunity. Thank you, sir.
Okay, thank you.
I'm going to share my hope everyone see my PowerPoint, right? Okay. I'm going to talk about today what is the alternate medicine for the prevention or the treatment of COVID-19. I'm Kabilan Vallai, Department of Oral Biology and Infectious Diseases at the Rutgers Biomedical and Health Sciences, New Jersey. As you are aware of COVID-19, it's been like the whole world is upside down, and every news, when you turn on the TV, always talk about COVID-19 or coronaviruses. The coronaviruses are large family of viruses that are known to cause illness ranging from the common cold to more severe diseases. As you will know, like there are three major coronaviruses identified. One is the Middle East Respiratory Syndrome, that's called MERS, which was first identified in Saudi Arabia during 2012. From the camel to it spread to human. The second one is a severe acute respiratory syndrome, SARS, which is identified in 2003. First infected humans was identified in China in 2002. It also comes from, spread from bats and then to cats to humans. The third one is now the 2019 novel coronaviruses, which called it short form is a COVID-19, was identified in Wuhan, China. This is a new coronavirus that has not been previously identified in humans. All three comparative the coronaviruses emergences is the total number of cases identified globally as of yesterday. Like the SARS is so far identified 8,000 and MERS is 2,000 worldwide, whereas COVID-19 is 21 million. The total number of deaths globally is because of the SARS is 774 patients died and MERS is 858 patients died, whereas in COVID-19, 776K, people are died. And the number of countries affected is in COVID-19, 188 as of yesterday, whereas the SARS and MERS, 26 and 27. So the magnitude of this COVID-19 number of death as well as number of affected countries, how the world is now affecting due to this coronavirus 19. How COVID-19 spreads? Based on what currently known is, this is the virus spread is person to person via respiratory droplets among close contacts. The CDC issued a guidelines that, how these symptoms of coronavirus once if you affected. The symptom of COVID-19, which can be include either one of the following. One is the cough, shortness of breath or difficult to breathe, fever or chill, or muscle or body ache, vomiting or diarrhea. Then the smell due to this loss of taste or smell. Doesn't matter, it is either one of them or combined, you will see patient to patient vary. The symptoms can range from mild to severe illness and appear 2 to 14 days after you are exposed to virus that causes COVID-19. So the seek medical emergency, that is very important to advise when you are feeling like a trouble breathing, persistent pain or pressure in the chest, new confusion and inability to wake or stay awake, bluish lips or face. So if you find any one of them, this immediately you will seek the medical emergency. How to prevent the spread of a respiratory disease like a COVID-19? The first thing is the distance between person to person is 6 feet. Stay at least 6 feet or about 2 arms length from other people. Cover your cough or sneeze with the tissue, then throw the tissue in the trash and wash your hands. When you are in the public, wear cloth mask or cloth face covering your nose as well as your mouth. And also do not touch your eyes, nose and mouth when you are in the public or when you are using the toilet, public toilet or in transportation, anything. Clean and disinfect it frequently. Touch the objects and surfaces. That is also very important to prevent the COVID-19. And also stay home when you are sick. That's the most important thing we should follow, except to get medical care. Even when you get medical care, you have to call first to the doctor office and make sure that you are, tell that symptoms and everything, then you will go to the medical center. Wash your hands often, very often with the soap and water for at least 20 seconds. That's the most important thing. So common sign, we saw so many symptoms, and there are some data from Wuhan, China. They reported that, how many people get fever, how many people get different other symptoms. It shows that the fever is 83% of the people have a fever, cough is 82, shortness of breath is 31, muscle ache is 11%, and confusion, headache, sore throat, rhinorrhea, chest pain, diarrhea, nausea and vomiting, loss of taste and smell. So most probably when you look at this, the fever, cough, shortness of breath, loss of taste and smell is most of the patients has these symptoms. When it is a severe, you will affected pneumonia and also immediately kidney failure, then severe acute respiratory syndrome, then finally the death. So 10 things you should do to manage your COVID-19 symptoms at home. So as there are several reports which suggest that most of the people, those who affected COVID-19 is when you take rest at home will be cured by itself. Whereas very few percent of the people can only need a medical attention. So stay home. First thing is, if you are sick, stay home. That's very important from work and also school. Any stay away from other public places, that is also another important thing. If you must go out, avoid using any kind of public transportation, ride sharing or taxis. That's all most important thing. Monitor your symptoms. That's another important thing. When you are, sick, check the temperature often. And if there is any new symptoms, get worse, so that it has to be monitored. Then cover your cough and sneezes, even at home. Otherwise, it will get spread. And also isolate yourself, even at home. Get rest and stay hydrated. If you have a medical appointment, to call the healthcare provider ahead of the time, so that you will not need to wait for at the doctor office. Wash your hands often, and also stay in specific room and away from other people at your home. That's another important thing. You cannot spread to your family. Avoid sharing personal items and clean all surfaces that are touched often, like counters, tabletops, doorknobs. Use household cleaning sprays or wipes according to the label which instructed. Another very important thing is cover coughs and sneezes, which stops the spread of germs that can make you other people sick. So cover your mouth and nose with a tissue when you sneeze or cough. If you don't have a tissue paper, just use your elbow to cover your mouth. Wash hands often with soap, especially when you are after cough or sneeze. Also very important, some of them when you go to doctor office or when you are going to office, it's important, like if you have a fever, cough, shortness of breath, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, any of these symptoms, if you found, please stay home. That's what the recommendation by CDC. Also, you have recently been, like some people are traveling or use a cruise ship or river cruise ship. Make sure that, take the following steps. Check your temperature after your cruise, whether you are okay. And also if you watch, you have a cough or trouble breathing, stay home and avoid contact with other people and do not go to work or school. Keep your distance from others. Same thing when you do for transportation with the other things. So, CDC published associated hospitalization related to underlying medical condition. That's the most important thing we should understand. How this COVID-19 is affected, who is affecting more, and how this underlying condition, those who are affecting this COVID-19. When you look at these different conditions, they are more, riskier than the healthy people. Asthma, hypertension, obesity, diabetes, chronic kidney disease, severe obesity conditions, two conditions, either two of them or either three of them. When you look at this, how many times this, when you look at this, the obesity is more, easily they can affect, and also they need more hospitalization when compared to asthma or hypertension or obesity. So the chronic kidney diseases and severe obesity and either a combination of either two or three, that has more, people admitted in the hospital, and also they need medical attention. And also like the factors that increase the community spread and the individual risk is due to these crowded situations, close or physical contact, enclosed space, and duration of exposure. These are all more, community spreading. So that is most important thing. We need to follow the regulations. So this data is now compare with the ethnical and race is also important. And when you look at these slides, what are the races? They are more affected due to this COVID-19. When you look at this here, the Black or African American non-Hispanic people, they have more prone to this COVID-19 infection, and also the death rate is also increased to 2.1 times higher when compared to other races. When you look at the Hispanic, they also have hospitalization 4.6 and the death rate is 1.1. And whereas the American Indian, Alaska, they have like a 5.3% hospitalization, but the death toll is less. Whereas Asian, non-Hispanic persons is very less affected, and there is no much, death reported. So that doesn't mean that the Asians are more immune to this COVID-19. There are some, statistical analysis that shows that in USA, North America, especially in USA, maybe they are more white-collar jobs. So most of them stay at home, so they don't have much infection reported. Whereas when compared to African American and Hispanic, they are the frontliner. They work, essential employer. They go out, they work, so they may be infected more. Be cautious that Asians are not immune to COVID-19. And also the age, who's more prone to this COVID-19? When you look at this data, which suggests that when you get old, you will more chance to need a hospitalization. For example, above 50 years old to 85 years old. So when you get old, you will have more chance to require the hospitalization. And also the death toll is very, very high when you are getting old. When you look at this, above 65 to 75% of the people, it's a crazy of death toll is higher. So that's why we have to be, those who are elderly people need more attention and follow the rules and regulation and keep that distance and, protect themselves. So before you travel, it's very important to consider the following, advisories. Do you live with someone who might be more likely to get very ill from COVID-19? That means the pre-existing conditions, or elderly people. Are you more likely to get very ill from COVID-19 for some reasons? If you are immunocompromised or any underlying conditions, you have to be very careful for this. Does your destination have a requirements or restriction for travelers? That also another important. When you are traveling, you have to make sure your destination is, how this COVID-19 affecting that area or everything. If you travel during your trip, take steps to protect yourself and others from COVID-19. And also you need to know when you are going for travel, the destination have a require or restriction for travelers. That is another important too. So now we're back in India, I think there are a lot of restriction to travel, and also from one to other place you need some travel pass or everything. So always make sure that is only there is an emergency you have to travel at this point. So consideration for travel of things, air travel, bus or train, car travel, either one of them, what doesn't matter, but you have to follow the rules and regulations. So this is a COVID-19, the CDC reported, how many people are reported, how many people, what is the statistical, analysis so far. So when you look at this, 31,000 plus inquiries from doctors, nurses, or other clinical staff and health departments received by CDC. CDC is nothing but the Center for Disease and Control. It's a body for, to get all this information and control these infectious diseases. Also, 2.3 billion people, social media impressions on 5,043 CDC response-related posts, and 1.6 plus billion times people have looked for information on CDC websites. And there are so many other, 1,195 CDC deployers who have conducted different cities across the United States and abroad to collect all the informations and everything. So this is, as you know now, how this coronavirus pandemic affected the worldwide, and how these people are, approaching to get more information from the CDC. So this data which suggests that as of yesterday, India's death toll is 50,921 death reported. So that is, we don't know the exactly things, but that's what officially they reported. And 188 countries are so far reported, the coronavirus is affected. So as we are foreigners traveling to, if we go to India, the CDC and also they issued warnings, like a warning level 3. So the alert level 2 is practice enhanced precautions. The level 1 is practice usual precautions. The level 3 COVID-19 risk in India is very high. So the CDC recommends travelers to avoid the non-essential international travel to India. So that means India is more nowadays reporting the COVID-19, so that the restriction from abroad also, recommended. because the travelers at increased risk for severe illness from COVID-19 should consider postponing all travel, including essential travel to India. COVID-19 risk in India is high now. If you get sick in India and need medical care, resources may be limited. Check your with the Office Foreign Affairs, Ministry of Health of India, or US Department to get all the details and current locations, other details. And also the strategies to control the pandemic COVID-19. So how do we prevent the diseases? What are all the strategies currently employed throughout the world? One is a lockdown, shelter in place, or societal measures, that is quarantine and isolation, social distancing, masking, and also hand hygiene. Then the TTT program is called testing, tracking, tracing. The tracking is a surveillance, and also therapeutics, drugs, IV, oral inhalants, and plasma phosphorescence. And also finally, the vaccine, only the hope to control this pandemic COVID-19. What is the current treatment for COVID-19? Antiviral treatment and also antibiotic treatment, oxygen therapy, and intravenous immunoglobulin therapy. So these are the treatment options now the hospitals routinely practicing to treat the COVID-19. Although no COVID-19 drug has been approved by the US Food and Drug Administration, also other countries, the respective agencies, they didn't approve the COVID-19 drug officially for treating this disease. And also there is no effective pharmacological treatment against COVID-19 so far, as of today. Determining the drug target, that is requires an understanding of the viral life cycle. That is the most important thing when people are now developing the drug or the previous drugs. They need to know how this pandemic COVID-19 you can prevent. So you need to understand the life cycle of the viral particles. That is that COVID-19 is a single-strand RNA enveloped virus. The COVID-19 and SARS-CoV-1, which shares a similar host entry mechanisms. It targets the cells by using a viral structural spike protein bind with the angiotensin covering enzymes 2, that is ACE2 receptor, forming endosomes which enter into the cells. The TMP or SS2 is the host type 2 membrane serine protease, which helps the virus enter through S protein. After the virus enters the cell, it synthesizes the viral polyprotein and RNA subsequently assembled to release the new virus particle into the cells. So the potential target for drug therapy is to inhibit the viral cell entry and also replication, and modulating the immune system could be a potential target for drug therapy. The current clinical trials on COVID-19 pharmacological treatments, which include hydroxychloroquine and remdesivir. The hydroxychloroquine, which reduces the viral load in COVID-19 patients, appears to be more effective when used in combination with zithromycin. Remdesivir proved its potential against COVID-19 by displaying clinical improvement, but there is no any valid clinical data to support, and also there is not FDA approved this treatment. But because of the pandemic, we wanted to save the lives. They have a hope. At least we can use this, and coming out in a lot of references, publications, and others to support more valid for this treatment option. And also there are a lot of clinical trials now going on to COVID-19 to treat with including hydroxychloroquine, chloroquine, immunoglobulin treatment, remdesivir, arbidol. There are so many 24 combination of drugs or individual that is, trial for treating these patients, but none of them so far approved by FDA. There are several pharmaceutical companies worldwide. They, developed these drugs for something else, and now they wanted to try based on the, molecular mechanism of this drug is similar to, malaria and also COVID-1, so that they wanted to try with this to, treat this pandemic COVID-19. The National Institute of Health is pursuing 4 fast-track focus areas to develop a collaborative, streamlined forum to identify preclinical treatment and also accelerate clinical testing of the most promising vaccines and treatments. Because of the urgency, we wanted to accelerate the, to approval once we get, the vaccine and everything. So they wanted to accelerate the clinical testing and also improve a clinical trial capacity and the effectiveness. That is also most important thing to get as quick as possible. Also, the 4th one is accelerate the evaluation of a vaccine candidate to enable rapid authorization or approval. So that is also very important, because usually when one drug, taking to approval takes for like 10 years. So because of this pandemic, they wanted to speed up all this, process. There are a lot of countries and also many biopharmaceutical companies, they're developing a vaccine for COVID-19. But as of today, there is no report any approved vaccine. But 2 days back, Russia declared that they have, approved vaccine for COVID-19. But still, that is we didn't get enough data to support that. So there are several companies, but usually when vaccine develop, it usually takes years to go for clinical trials, 1 to 3. Stage 1, stage 2 clinical trials, and then they have to analyze all the data and want to see any side effect and everything. Then it apply for, submit for FDA approval, and then only it has to be available for treatment options. But only thing is, even this vaccine is not for a long time. It is only short period of time only it's valid. So for 3 months or 4 months. Then again, you have to have another vaccine. So the protection is only for shorter period. So there is no specific antiviral treatment available in the modern medicine to treat COVID-19. Also, there is no effective vaccine available as of today. So at this critical condition, it is imperative that resource-starved nations and the communities, they're looking for alternative medicines for prophylaxis or treat themselves against this COVID-19, because we could not able to go all of them into the hospital. So how we can treat ourselves? That is also most important thing right now for people all around the world. It is also worldwide emergency, and the primary goal of management is to survive. While many clinical trials aimed at discovering a potentially effective COVID-19 drug are ongoing using herbal medicines, which well-known antiviral activity might be complementary SARS-CoV-19 preventive therapy. So, what is the alternative? At this point, we don't have any more allopathic medicine or any vaccine is available to control or spreading their infections. So what is an alternative medicine, and how we can protect ourselves, or how we can prevent this? Prevention is better than cure. So what is the alternative approach? So all around the world, they are now focusing more on alternative medicine to prevent or treat this COVID-19. So one is like traditional Chinese herbal products, Japanese traditional medicine, and Indian government Ministry of Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy is also promising herbal product is to treat for the COVID-19. So what are all the herbal products? How we can able to take that one? So local prophylaxis, medicated water, mouth rinse and gargle, nasal oil application, steam inhalation, systemic prophylaxis, and rasayanas and so there is no scientific evidence that any of these alternative remedies can prevent or cure COVID-19. Whatever I am going to present, that it is only to support and a published one, but not scientifically or any agencies are so far approved to treat this COVID-19. So the herbal products. So the herbal products, there are several herbal products now coming out to report that it improve the immunity and immunomodulatory properties. So that even if we infected with the COVID-19, if we are if we develop the immunity, then you will get free from COVID-19 as soon as possible. So there are some reports which is reported that aloe vera and other herbal products like Mongolian milkweed tea, Ganoderma lucidum, Panax ginseng, these are all reported to exhibit immunomodulatory properties. And also there is a report rice bran, wheat bran, and Haina, Eastern purple cornflower, and plumbago, and the Ceylon leadworth, which has also exhibit immunomodulatory properties by stimulating phagocytosis, so that you can take this herbal product that you will get and more immunity, so that will even if we infect with the COVID-19, this will help us to modulate the immunology. And also there are reports the eucalyptus essential oil is reported to improve the innate cell-mediated immune response that can be used as an immunoregulatory agent against the infectious diseases. And collectively, using these immunomodulatory food and herbs could enhance the immune system, which protect the body against COVID-19. However, this is very important. This observation must be verified through scientific or clinical. And there are several products with Ayurveda that treat COVID-19. One is Asimum sanctum, that is a tulsi extract. This one not only for to treat the COVID-19, but which helps to get an fever, cough, asthma, anxiety, diarrhea, vomiting, indigestion. So due to this COVID-19, you will get all these kind of symptoms. So if you take this tulsi extract, you will feel better during these infections. And also Amritarishita, that is another beneficial for all type of fever, which is a chronic fever, malaria, recurring fevers, and accompanying complaints of enlarged the liver and spleen, also digestive disturbances, which contains a lot of herbal products. It's a combined one. And also Agastya haritaiaki, which contains haritaki as one of the main components, which also treat for cough and intermittent fevers. So that if you take this also good for has an antiviral properties. There is another report also, Samsa manivati, that is another Tinospora cordifolia, which Giloia, that is extract, which contains many constituents such as alkaloids, steroids, glycosides, and polysaccharides. So its extract is extensively used in various herbal preparations for the treatment of different diseases. because of this immunomodulatory, anti-inflammatory, antioxidant, anti-osteoporotic, arthritis, and allergic property. So it is one of the best herbal product. Then Trikatu, Pipali, Mariak, and Shanti powder, that is also which contains the tulsi leaves. This formulation which helps the fiber nigrum, fiber longum, and dried rhizomes of Gingiber officinale, which mix together equal quantities and which possess antioxidant, immunomodulatory, anti-allergic, anti-arthritic activities. The studies also reported it's also prescribed for the treatment of asthma, cough, chronic rhinitis, sinusitis. Ashwagandha, that's another important plant, herbal, called Indian ginseng. It is known for antimicrobial, anti-inflammatory, anti-tumor activity. It also helps to show antiviral activity against infectious. Sorry. And also recently, Girijai and Sivan in 2020, they treat a patient in Newark Hospital, treating with Ayurvedic treatment for things. So the patient, it is a study, the stage 1 to 4 days. So they give Sudarsana Surna, then Talisadis Churna, then Danvantara Tika. So these three combination of herbal product they give to these 1 to 14 days to the patients of COVID-19 infected patients. Then after 14 to 30 days, they give Chikitsa Sthana and also Vaidariadi Gritam. That is the two herbal product they give to the patients. After reaching a peak temperature of 103 Fahrenheit, the symptoms started to subside when treated with these churanas. On day 7, the patient felt that all symptoms had subsided, fever, body ache, cough had resolved, and appetite, except loss of taste and smell on day 7, whereas it's during 16, the sense of smell which also returned on day 16. So these drugs, the herbal product, they used to treat the COVID-19 successfully, and that was published in recently. Also, there is a homeopathy treatment also, the Arsenicum album 30 cc. This is also Indian government also recommended that this Arsenicum album 30C, which is prepared by diluting aqueous arsenic trioxide until little or no arsenic remains, so that there is no toxic, and is used for respiratory disorders. So Arsenicum album 30C and 2 drops of sesame oil in each nostril each morning are suggested by the advisory given by Central Council for Research in Homeopathy, India, for prevention to the COVID-19. And also there is a report in animal model, the mice intoxicated with arsenic trioxide injections when treated with Arsenicum album 30 showed a revival and restoration of protein and DNA damage of liver and kidney. So some improvement in the clinical outcome of acute encephalitis syndrome also observed with the treatment of this Arsenicum album. So there are several reports on Unani for COVID-19, that is Sharbat Unab and Kamira Marwat, Rogam Bambuna, Argu Ajib, Heba Iskar Bukar. So these are all Unani treatment for COVID-19 they reported, and this formulation consists of plant extract of different things for each one of them. So which also gives better relief due to this COVID-19, and also a lot of other these drugs is gives for dengue fever and other diarrhea for argue, anjab, and Rogan babuna, which gives for rheumatoid arthritis patients, osteoarthritis patients. So these are all already people are taking, but due to this COVID-19, some prescription which helps to relieve the pain due to this COVID-19. And there is another, Unani drugs, Bihidiyana, Sapistan, Darchini, Banafisha. These are also has a lot of anti-inflammatory, antimicrobial, antioxidant activities, and which also prevent the cough and things. So which will help the patients for relieving this pain. And there are a lot of other Unani treatment. Also, the Neem Bark, as you know, in India, people will take usually take the neem leaves for prevent the chicken pox and other things. So definitely, this will also help to treat this COVID-19 relief pain. That's all that the people are reported. And also there are several other root extracts of casni that is also show anti-tumor and immunomodulatory properties. The dried root is used for tonic and fever, so that's very reported. Also there are another guli shurk, that is Rosa tamansis flower. It is medicinally used in various diseases such as bronchitis, wounds, and ulcer. The mixture made by rose and honey is very effective again. So far we saw about the Indian way of treatment, this alternative approach by using different herbal products and way of treating the patients with Unani, homeopathy, and Ayurvedic. And now we talk about international herbal product, especially the traditional Chinese medicine is famous, and mostly combination of this traditional Chinese medicine were proposed for the prevention or treatment of COVID-19. In China, the total number of confirmed cases treated by this medicine has reached more than 60,000 people cured due to this treatment of this traditional medicine. It was reported in Ren et al. In 2020. When you look at this, there are a lot of herbal products is available in Chinese market that will help to treat this COVID-19. There are several formula and several plant products which helps to treat this COVID-19. The pattern identification. Sorry. Yeah. So the pattern identification and herbal medicines recommendation for pediatric. So those who are affecting due to this COVID-19, the children's, there are another herbal combinations. There are more than 10 combination of herbal products. It is help to treat the pediatric patients due to this COVID-19. Also, recently they reported the most frequently used Chinese herbal medicine is leucaric root, Baikal skull cap root, Pinelia rhizome, Forsythia fruit. So these are all the combination of this herbal product is very most frequently used, due to this COVID-19. Comparing this Chinese medicine, the conventional Western medicine groups, they compare this Chinese medicine improves in several clinical parameters reported, which includes lung CT, clinical cure rate, ranging from mild to critical cases, and length of hospital stay is reduced. Total score of clinical symptoms are also reduced. Fever reduction time, symptoms score of fever, number of cough reduction cases, symptom score of cough, number of fatigue reduction cases, symptom score of fatigue, which all disappear due to this Chinese medicine, herbal medicine, when compared to the Western medicines groups. And also there is a very famous antiviral activity herbs against this, COVID-19, Lianhua Quinhuan formula that contains 13 herbs, which was reported in Ding et al. In 2017. This formula, this drug combination of these Chinese herbal products, which helps to treat this COVID-19 effectively. And also there is a report in Japanese herbal medicines. There are 5 herbal products which is helps to treat the COVID-19, and the Japanese market, which selling these drugs for COVID-19, and which will reported very effectively help to alleviate the pain due to this COVID-19 and also prevent this infection. So we wanted to talk about what is the myth versus reality. That is most important thing. So far we discussed about the herbal product and also how we can treat the worldwide using herbal product, even though there is no FDA or other countries agencies approved, but due to this pandemic emergency, they wanted to avoid the death of death due to this infection. So they at least they recommend you to treat the patients with the herbal products. And there are still myth and the reality we need to know. That is very important. Does the COVID-19 affects only older people? That's we need to understand. Generally, when we talk about the previous slides, that the elder people has more prone to infected due to this COVID-19, but doesn't mean that the elder people only affect due to this COVID-19. Are antibiotics effective in preventing and treating this virus? So no antibiotic can treat a virus, even including the COVID-19. Are there at this time any specific medicines to prevent or treat this virus? There is no any approved drugs treat this COVID-19. Can pets at home spread the virus? No. Can goggling the mouthwash protect the COVID-19? As of 3-4 days back, it is no, but now there are reports that some mouthwash that protect from COVID-19. So maybe like I will find out more details in coming days, how we can prevent due to this COVID-19 using the mouthwash. Do vaccine against pneumonia protect against COVID-19? That is not also true. So it does not protect against COVID-19, the pneumonia vaccine. Also the true or false. You can get a face mask exemption card, so you don't need to wear a mask. That is, the answer is false. You can protect yourself from COVID-19 by injecting, swallowing, bathing in, or rubbing onto your body using the bleach or disinfectants or rubbing alcohols. The answer is false. So you cannot swallowing or bathing, rubbing onto your body or bleach or drinking. A vaccine to cure COVID-19 is available at this time. The answer is no. It's false. The new coronavirus was deliberately created or released by people. That is also false. We could not, there is no any data that suggests that it is released by people. So far as of today, everyone believes that it comes from the animal bat, but still there is an investigation about this. Ordering or buying products shipped from overseas will make a person sick. Is it true or is it true or false? It is also false. It won't make any contamination, and that will spread to people. So these are all very important. We need to know the myth and the reality, because there are a lot of stories, a lot of WhatsApp or social media, each and everyone spreading the rumors and other things. We have to be very careful to at this time. So because of the pandemic, we don't have any treatment option and other things. So we have to protect ourselves and also avoid all these myth and reality. The current literature demonstrates a strong evidence in support of therapy and herbal medicine as potentially effective against COVID-19. So for future studies, we need to address the following 4 potential approaches for the application of dietary therapy and herbal medicine against COVID-19. One is using foods and herbs as diet or supplement to prevent infection and which strengthen the immunity. That is most important thing we should consider when you use any herbal products and other things. Use as an antiviral agent by coating on mask. That is another important thing. So when we wear the mask, maybe if we coat any antiviral agents, so that can protect, from the virus. So the antiviral drug then can kill the virus, so that it can protect that way. Also use as an anti-disinfectant essential oil to stop aerosol transmission, because the COVID-19 is spreading through the droplets. So if we use any air disinfectant, that will help to prevent this aerosol transmission. And also use as a surface sanitizing agent to provide a disinfected environment. That is also another 4 points we have to, important for this to control this infection very effectively. Finally, we concluded that currently there are limited number of allopathic medicines considered effective against COVID-19. The design and development of drug and vaccines were elucidation of the mechanism of SARS-CoV-19. So the current literature provides obvious evidence supporting alternative medicines as potential effective antiviral agents against the COVID-19, and also its preventive agents against the COVID-19. However, these hypotheses require the experimental validation in SARS-CoV-2 models and COVID-19 patients. So prevention is better than cure. So wash your hands frequently, avoid close contact, cover your mouth and nose with a mask when around others, cover cough and sneezes, clean and disinfectant, monitor your health daily. Then you no need any of these treatment so that you will be healthy and safe. So thank you. Take this opportunity to thank you all to listen my talk. Also given an opportunity to share my and share the facts. Thank you, sir. And
thank you, sir. Very excellent session, sir.
Dr. Kabilan, thank you very much, Kabilan.
Thank you
Now
very
the
much, sir.
session is open for discussion. Participants can discuss with our chief guest.
ഗ്രോത്ത് റേറ്റ് കാണിക്കുന്ന ഒരു പീരീഡിനെയും അതുപോലെ തന്നെ വ്യത്യസ്തങ്ങൾ അല്ലാത്ത കോൺസ്റ്റന്റ് ആയിട്ടുള്ള ഗ്രോത്ത് റേറ്റ് കാണിക്കുന്ന ഒരു പീരീഡിനെയും രണ്ട് പീരീഡ് ഉണ്ട്. അതായത് എന്തായിരിക്കും കോൺസ്റ്റന്റ് ആയിട്ടായിരിക്കും ഗ്രോത്ത് റേറ്റ്.
Dear participants, please share your ideas.
പീരീഡിനെയും കൂടെ നമ്മൾ എന്ത് ചെയ്യും, രണ്ടായിട്ട് തന്നെ കണ്ടിട്ടായിരിക്കും ഇതിനെ നമ്മൾ അപ്രോച്ച് ചെയ്യുന്നത്.
Now the session is open. Dear participants, the session is open for all.
Hello. Hello.
yes.
Hello.
Please come on, please.
Yeah, I am calling from Kolkata.
Yes.
Sir, please introduce yourself. Please introduce.
Besides
Hello.
these Ayush systems of medicine, there are some more alternative therapies like acupuncture is there any role of acupuncture in the treatment of COVID-19 or in the prevention?
But there is no any scientific
Hello.
evidence which shows recently with acupuncture. But any treatment that if we treat this, definitely it will be effective. But I don't know. I don't have any knowledge about treating this COVID-19 in the acupuncture.
Okay, thank you so much. Thank
Yeah,
you.
thank you. Also, that there is a problem with the acupuncture and other thing is the contact. The person you contact the persons to treat. So yeah, it's very tough, I think.
Thank you.
Sir, please come one by one. Sir, shall we complete the meeting? Hello. Dear participants, the session is open to you.
Yes, sir.
Please come one by one.
Okay, sir. Okay.
Sir, please come one by one.
Kabilan, there is a question on the chat. It says, can anyone be affected by rainwater and the COVID situation, flooding and COVID?
I think that there is no report so far, I guess, or to my knowledge, there is no report on due to this rain or flooding. Yes, there is no report so far.
Thank you, Dr. Suresh Kumar. If you have any idea, please share with us.
I wanted the people to ask, then I will. Ask.
I have a question to Professor Kabilan. So you have showed us like quite a few Chinese traditional medicines being used to treat for COVID-19. So do we? I mean, you showed us this particularly one paper you cited a paper, but apart from that, do you think it's there any other research has been shown that it's very effective on COVID-19?
Yes, there are several reports. It is a review article I quoted. So there are several papers which published with the different. All this I showed. All the herbal products. Everything is a published one with the different authors. So and also it's a government also approved this to treat the COVID-19 patients. So it is effectively treating the patients with these herbal products. Yes, it is scientifically they reported, but it is not like the drug agencies are approved. But due to these things they treated, and as I reported that more than 60,000 people are cured due to this, treat with the herbal products. So it's not only one paper, but there are several papers. So that is a review article. So yes.
Thank you, Professor. Yeah. And I do have one more question related to the same, coming back to this Ayurvedic medicines or Ayurvedic medicines used in Indian context. So how much has been published regarding on those
Very few papers published regarding this. That I saw one review article about the Ayurvedic herbal products. How many of them they studied in India? So it is not much, and very few papers. That's why it needs more. That's why in Indian herbal product is not popular, because there is no much data we could see, scientific evidence. So not that many papers, very few papers I found.
Thank you, Professor, and it was a nice talk. Thank you.
Thank you.
So once again,
yeah,
sir,
yes.
Is it possible to get the PowerPoint presentation, sir?
Yeah, I will share, definitely.
Okay, can I get by email?
Yeah, sure.
Thank you so much, sir. Thank you.
Yeah.
Thank you, sir. Thank you so much.
Dear participants, is there any question?
Hello.
Yeah.
Sir, any animal infected COVID-19?
I think it is coming from bats only. There are reports, one or two reports, reported. I think dog also infected. There is a report. So it is spreading from animal only, bat. So there are few reports. Yes.
Sir, in your slide, mention you animal cannot spread COVID-19.
Yeah, right. Yeah, so few reports, see, in the pandemic diseases, every moment it is changing the scenarios. So there are some reports, yes, but not spreading like humans, but there are some reports.
Okay, sir. Thank you so much, sir. Your session is, sir, very well, sir, and informative, sir. Thank you.
Thank you, sir.
Thank you, madam. Madam, shall we wind
Sir,
up the? Please come.
sir,
Hello.
certificate मिलेगा ना?
You can get the certificate as usual after the session is over. Hello.
Hello. Sir,
Hello,
आपकी आवाज
come on.
slow आ रही है.
Shall we proceed to wind up?
Yes, sir.
Good afternoon to all participants. Now the time is 2 o'clock in New Jersey, USA. Without the time schedule, our Chief Guest, Dr. V. Kabilan, accepted our invitation and gave the very resourceful information. He attended the webinar for the past 1.5 hours. Then first of all, I want to thank the Chief Guest, Dr. V. Kabilan, and Dr. Suresh Kumar Balasubramanian from Australia. He is also attending the webinar. The participants from all over India, not only Tamil Nadu, I wholeheartedly thank all the participants. And now coming to the principal and CEO. Without the help of the CEO and the principal, we are not able to conduct the webinar in time or in the scheduled date. So we thank on behalf of NSS, we thank the principal and the CEO. Then our chairman, correspondent madam, is also helping us in so many ways to conduct such type of international or national webinar as per the schedule. On behalf of Dr. SNS Rajalakshmi College of Arts and Science National Service Scheme, NSSPO, Dr. Ilangovan, Dr. Suresh Kumar, Dr. Shyamala Vasanta, and myself, thank one and all. Thank you very much. Thank you. Thank you.
Thank you.
Thank you, Kabilan.
Thank you, sir. Bye.
Thank you. Thank you.
Kabilan, thank you. You go and have a
Thank you.
nice sleep. It's too late for you.
Sir, 1 minute, sir.
Hello.
सर सर्टिफिकेट ईमेल पे आएगी ना?
Sir, thereafter, certificate will come through email.
Okay, sir.
Okay,
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 thank you.
sir.
Thank you so much, sir.
Okay, thank you. Thank you, sir. Thank you so much.